today we're going to be talking about surgical procedures, staging surgery, how to optimize yourself for surgery, what to be prepared for, and how to get the best result. Hello, I'm Dr. Yuli Gorodisky, and welcome to the Beauty Confidential podcast. So let's talk about revisions. Plastic surgery sometimes does, end up with a great result right off the bat, and one and done, you're ready to go and enjoy your great life and great results after surgery. However, a lot of times patients will experience some setbacks and may require some revisions, and there's a couple of reasons for that. So number one, of course, plastic surgery is an art. Okay, it's an art that's based on science, and we are dealing with living tissues, living patients, and not everybody is exactly the same. So it's not a cookie cutter approach. It's not a stamping technique. You can't just produce multiple of the same thing all the time being exactly the same. Just like you can't do the same thing exactly the same on both sides of the body. Now, we always strive for perfection. We always try to make things look the best. However, sometimes things just are not exactly the same, and it could be due to patient's anatomy, due to their tissues, due to various factors which are sometimes unpredictable. So sometimes when things are done and everything comes together and looks great, as things heal, they may heal a little differently. Maybe one side heals different from the other side. Maybe overall things are just they're nice and tight in the beginning, but then over time, tissues relax a little bit, or sometimes things don't heal as well or as fast as we want them to. So patients may get some scarring, they may get some asymmetries, they may get certain things that may require tweaking. So revisions are basically a part of the whole experience. And if you are considering plastic surgery, you need to be prepared that you may need a revision at some point. It could be something minor, like removing a little piece of skin, or correcting a little deformity, or improving the scar, or it could be something major where you might have to change your implant, or maybe you have to redo the procedure because it just doesn't look right. So those are kind of rare, but possibility. So why do things happen? So sometimes when you are doing a procedure and, especially if it's a skin tightening procedure, the goal is to get the area as nice and tight as possible and still have a very nice and thin scar. Now, the reason why scars don't heal so well sometimes is when there's too much tension and the tissues are too tight and pulled together really tightly. And as things heal, sometimes the scar can spread a little bit, and that makes the scar look wider and not as good looking. It can happen due to just, technique. It could be due to tissues being a little bit weaker. If somebody had lost weight, or if they have a lot of stretch marks and their tissue doesn't have the same elasticity, they may not heal as well. Also, if patient smokes, or if the patient just overdid it, or just some other reasons where for some reason the healing didn't occur as fast as we wanted to, and the scar can separate, and then you get a little bit more worse scarring. Usually scar revisions are not a big deal. You already have a scar. All you have to do to revise it is you inject the scar with numbing solution. You can do it under local anesthesia, or you can do it under full sedation or general anesthesia. You remove the old scar, you restitch it back together. Usually the new scar ends up to be much better. However, some patients are prone to getting bad scarring and keloids and thickening of the scars, and they may get a recurrence of bad scar, and there might be some other things we have to do about that. But we can discuss that. So you have to be prepared that potentially you may need a revision, potentially you may need to have touch-ups. And, it's just part of the whole process. It's not an exact science. We try our best to do the best every time. However, sometimes you may need a little tweak for the best results. Another topic I wanted to address is the importance of post-surgical care. So we always reinforce to our patients that when you're having surgery, you have to be mentally and physically ready. Okay, so mentally means you have to be confident, you have to be accepting, you have to be ready for some discomfort and be ready for a little bit of recovery time. Things are not happening overnight. You're not going to wake up the next morning with a perfect result, perfect body. It takes some time for things to heal. So that's mental preparation. You also have to be ready to have support system in place. So you need to have people that will help you to get through the process. Sometimes there are ups and downs with your mood. There's sometimes some little bit of depression that can happen right after surgery just because you're uncomfortable. You may be, you look in yourself and you don't see what you want to see. So those are the things that you need to get through, and you need to be ready, and you need to be prepared mentally that this may happen. And then physically, of course, we want to make sure patients' health is optimized, that you're eating a well-balanced diet, that you're, good on your protein. You have to make sure that when you have surgery, you're not in starvation state. So what does that mean? If patients are planning to lose weight, they need to lose that weight first. You don't want to be in the process of weight loss while you're having surgery, because your body needs the energy, needs the protein building blocks to be able to heal. So if you're losing weight, you want to stop the weight loss and get to a point where you're going to be stable before having surgery. And of course, if you take any vitamins and things like that, you want to make sure that we discuss what you're taking, because some things may not work well with anesthesia or surgical recovery. So, avoid things like blood thinners, things that can, potentially overexcite you or make your recovery more uncomfortable. So, we need to go over all of those things. And of course, if you require medical clearance, we have to make sure that you see your doctor, get a full workup that's necessary for the procedure you're having. Not everybody needs that, but people who do really need to take that advice. And of course, you have to make sure that you're not doing anything else to hurt your results, such as smoking. If you have any underlying medical problems, they're well controlled, that you're healthy and optimized for surgery and for your recovery. So another question is, what impacts your results? So a lot of times I see patients who are thinking to get something done, but maybe they're not physically ready. So what I mean by that? So if somebody comes in wanting to have liposuction, but they're maybe a little bit overweight. Liposuction is not a treatment for weight excess. Usually you would need to consider a weight loss program or do something to get to the weight you want to be. And liposuction is more of a contouring procedure or a finishing touch procedure. Now, if somebody is planning to lose weight and they just say, I can't lose the weight, maybe you can do a staged liposuction procedure to help them through. However, what may end up happening is if you don't have your weight under control, you may gain the weight back, or you may gain it in other areas, and it's going to be a never-ending cycle of getting liposuction and then gaining it right back. So not a good idea. You have to make sure that the weight is under control before having liposuction. Now, when somebody is planning to lose weight and they're not willing to take the time to get to their goal weight and they just rush into surgery, what can happen is eventually, if they do lose weight, their results may not be optimal. So what that means is, let's say you do a tummy tuck, but you still are overweight. And then if you end up actually losing the weight at some point, the tummy tuck will be fine. However, you might see more skin, and then you may need another tummy tuck, or you may need more skin removal. Same thing with the face. If you are a little bit heavier in the face, even though you have a lot of excess, if you lift your face and you'll look better, and then you end up losing weight, you will notice a lot more skin sagging, even though you already had a facelift. So that's why it's very important to get to a point where you will be at a stable weight and you want to be ready for your surgery, so that way you get more longer lasting results. So I get a lot of questions asked if somebody comes in and they want several things done. Your surgery time in the OR should be limited. At least, in an outpatient facility, not going to be operating on somebody for more than like 5 or 6 hours at most. So that means that when you come in and you're going to have your surgery, we want to have enough time for you to recover before you're able to go home. Most of my surgeries we do in our outpatient facilities are outpatient surgeries, means you go home the same day. Now, if you're in the hospital, it's a different story. You can stay in the hospital and you get a little bit more aggressive care. But when we're talking about cosmetic procedures, most of them are elective and we want to keep them safe and we want you to go home the same day. So what does that mean with respect to what you want done? If you're thinking of doing, let's say, mommy makeover, so usually that involves breast surgery, tummy surgery, and some liposuction. Usually that procedure takes about between 4 and 6 hours, and that would be the maximum that we could do. Now, depending on what needs to be done, you can do a breast lift, you can do implants, you can do fat transfer to the breast, you can also do a tummy tuck, you can do liposuction. All of those things take time. But if you wanted to add more things, let's say you wanted to have your arms done or your thighs or, other procedures like a facelift, that would be too much to do in one surgical setting. So we would have to stage it. So for staging purposes, I would like to have about 3 months gap between surgeries so that your body can adjust. A long procedure like a mommy makeover, you may recover for about 3 months before you're fully back to normal. It means your electrolytes and your blood count and your just overall well-being has to be back to normal before you put your body through the stress of another surgery. Sometimes if somebody wants to have, let's say, a BBL and a tummy tuck, you can do it at the same time, but the difficulty becomes how do you recover? Usually when you do a BBL, your recovery is going to be on your stomach because you don't want to put weight and pressure on the fat where you inject it in the buttocks. And then if you do a tummy tuck, you can't really lay on your stomach because you have to be in a flexed position because your skin is nice and tight. So you have to recline and you have to lay on your back to recover. Now, so you can't do both. However, if somebody really had to, they could make some adjustments and put some pillows under their thighs and under their back, and so they could get away with it, but it's not the most comfortable thing. So if somebody wants to do Mami makeover with a BBL, I would give them an option of doing them separately, doing the breast and the tummy surgery separate from the liposuction and the fat transfer surgery. Now, if we do the BBL first, then you could probably, after 2 weeks of recovery of your stomach, you can lay on your back, then you can proceed with the front surgery. However, if you do the front surgery, the breast and the tummy, you probably want to wait about 3 months before doing your back, because you don't want to be laying on your fresh breast and your fresh tummy with the incisions being there. So we have this discussion and we kind of figure out the best plan, but usually some surgeries may need to be staged. And it's for your own healing, for your own comfort, and for optimizing your results. Now, if somebody wants to add a facelift to their surgery, so I usually do not recommend doing a facelift when we're doing the rest of the body work. The reason being, facelift does take a little bit more time, so if you're doing a lot of body work, it will increase your surgical time quite a bit. And the second reason is, I usually do my facelifts under sedation, so you're not under general anesthesia. So a lot of times, if you're doing body work, you're fully under anesthesia, and if you add face to it, it adds all of that general anesthesia time. So for me, I'd rather do the face by itself on its own day under sedation, where the patient is going to be just focused on their face, and they can recover much easier than if they're doing a full body work and under general anesthesia, and then we have to work on their face. The recovery is going to be a lot more difficult, and anesthesia time is going to be a lot longer. So usually I don't combine facelifts with the rest of body work. Today we discussed various topics on surgical recovery, expectations, complications, and how to be prepared when you're planning to have a cosmetic surgical procedure, and what to know and what we usually discuss when we talk to patients when we're getting them ready for surgery. And if you find this information helpful, please don't forget to give us a like and turn on your notifications and make sure that you follow us when we have new content coming up. And if you have any questions, feel free to comment below and we'll address it at our next podcast.